Welcome to the New Jersey Climate Change Resource Center Fall Climate Academy's webinar on the TRECH project, Estimating Health and Equity Benefits of Transportation Climate Policies in the Northeast and Mid-Atlantic States. My name is Marjorie Kaplan, and I'm both Associate Director of the Rutgers Climate Institute, and along with my colleague Jean Herb of the Blaustein School of Planning and Public Policy, I co-direct the New Jersey Climate Change Resource Center. A few logistics. Today's webinar will last until 12:30. Other than today's presenters and our Rutgers team, you're all muted, so to communicate with us, please type your questions into the chat box. And to find the chat box, look at the bottom of your screen. You'll see a little bubble. It says chat. And if you click on that, you can send us questions and comments. And please send your notes to all panelists, as that ensures all of us working behind the scenes today will see your questions. Thanks to my colleagues, Matt Drews and Jean Herb here at Rutgers for their help with today's webinar. We welcome your thoughts and questions. And I want to let you know we're recording today's webinar and it will be available on the New Jersey Climate Change Resource Center website, which I'm about to put into the chat box, assuming I can do this. So let's just make sure. I'll put that right there, and you can all see it if you want to see prior webinars. One continuing education credit is available through the Association of State Floodplain Management, and one certification maintenance credit is available through the American Planning Association today. We're very pleased to present today's webinar by Fallon Lambert. Kathy Lambert is a senior advisor with the Center for Climate, Health, and the Global Environment at Harvard's T.H. School of Public Health. She's also a co-founder of the Science Policy Exchange and research associate at the Harvard Forest. Kathy co-leads the Transportation, Equity, Climate, and Health Project, which is an independent, multi-university initiative analyzing the air quality and activity mobility benefits of transportation policy scenarios. She'll present preliminary findings for the first phase of the TRECH project focused on policy scenarios for the Transportation Climate Initiative and outline plans for phase 2 focused on integrating power sector emissions and conducting local case studies. Kathy holds a BA from Dartmouth College and an MS from the Yale School of the Environment. She's a Switzer Fellow, a Leopold Schepp Scholar, and recipient of the EPA Environmental Merit Award. It's my pleasure to invite Kathy Lambert to bring up her slides, turn on her microphone, and take it away. Thank you.
Thank you, Marjorie. And I will keep my eye here on the screen sharing option. As soon as I can share, I will. All right, the screen sharing option has come up. Thank you all for joining today. I'm very pleased to have the opportunity to share with you the preliminary results from the TRECH project. And as Marjorie mentioned, the TRECH project is a multi-university collaborative. So it includes colleagues at Harvard T.H, but also at Boston University, University of North Carolina, and also Columbia University. So first off, a little bit about the TRECH project itself. In addition to being a multi-university collaborative, we're conducting an independent analysis, starting with 5 scenarios for the Transportation Climate Initiative, or TCI. We're sharing preliminary finding to foster dialogue and inform policy choices, such as the TCI Memorandum of Understanding that's expected to be finalized later this fall. We've relied on published peer-reviewed models commonly used by EPA and other states in regulatory analyses. And it's been reviewed by our team of 10 experts, but not yet published in scientific journals. So we're clearly labeling the work as preliminary, and the results are subject to change. And I'd like to point out that scenarios, it's important to keep in mind that scenarios are just that. They're illustrative, they're not predictive. And so the actual benefits of a TCI program or any other transportation policy programs will depend on final state actions. And those include things like what is the cap level that's set, what investments are generated and how are they allocated, and are there any other policies that might be simultaneously influencing transportation. So what is the Transportation Climate Initiative? Many of you may be familiar with it, but just as an overview, It's a regional collaboration that aims to reduce carbon dioxide emissions from on-road vehicles. So its primary focus is as a climate mitigation initiative at the regional scale. Its approach currently is it's proposed as a cap and investment structure, and it would apply to states from Maine to Virginia and also to the District of Columbia, depending on how it goes forward and which states ultimately decide to join. The cap would apply to on-road diesel and motor gasoline, so it's not all of the transportation sector. It would apply to on-road transportation. The point of regulation would be liquid fuel wholesale suppliers. So it's not the tailpipes themselves. It's geographically dispersed in cap on the suppliers themselves. And suppliers would need to hold allowances for the CO2 content of their fuels. The allowances would be auctioned off annually and decline over time as the cap tightens. And the auctions would generate proceeds that are distributed to states for investment, which could include in transportation sector itself. The proposed program is intended to start in 2022 with some constellation of states if it goes forward. And the scenarios that are currently available to analyze would reduce CO2 emissions from on-road vehicles by an estimated 20 to 25%. And that's from 2022 levels by the time of full implementation in 2032. So if you compared the year 2032 with and without the policy, that would be equivalent to a 1 to 6% reduction in emissions in the year 2032, looking at with and without the policy. And as I mentioned in the last slide, there's a final MOU that's anticipated out by the end of this year. So I just wanted to kick off with some of these insights that then I'll share some details of as we go. So there's nearly a fourfold difference in the estimated health benefits across the policy scenarios. So that fourfold difference underscores that the actual choices will make a big difference in the outcome. So it's a wide range of possible health outcomes, and the actual benefits will depend on what states do. The estimated health benefits for the 5 scenarios that we looked at are larger than the program proceeds. And that's for the subset of benefits that we examined. The estimated health benefits include up to 1,000 deaths avoided and other health outcomes under the top performing policy scenario in the year 2032, so when it reaches the cap level. And that top scenario is the one with the largest health benefits, is the one with the most ambitious cap, so 25% cap, and the one that has the largest share of investments dedicated to public transit and active mobility. And by active mobility, we're talking about investments in biking and walking infrastructure. Under all the policy scenarios we examined, health benefits occur in all counties across the region and are concentrated in more populated areas. We also looked at changes in air pollution exposure by group, and we find that all policy scenarios would modestly reduce existing inequities in air pollution exposure by race ethnicity, but people of color would still face higher overall air pollution exposures, and more emissions reductions would be needed to address these pre-existing inequities. So what are the scenarios that we looked at in the study so far? And again, this is phase 1 of the TRECH project. So this is focused on state-defined TCI policy scenarios. And in our next phase, we'll broaden it to look at scenarios that go beyond these state-defined scenarios and include stakeholder-defined scenarios, scenarios that are defined by the research team. But for these 5, they represent 3 different investment types. So they're described here as scenario A, B, and C. And within that, 3 different cap levels, the 20, 22, and 25% CO2 emissions reduction cap. For the middle case, scenario B, we looked at all 3 cap levels. And then for scenarios A and C, we looked at the highest cap. We'll be presenting, coming out with an update that looks at includes results for all 3 cap levels and all 3 scenarios. So the investment scenarios represent different allocations across different transportation investment options. So as you can see here, there are 6 different buckets of categories of transportation improvements that could be invested in: for electric vehicles, low and zero emissions buses and trucks, public transit, infrastructure for biking and walking, improving system efficiency, and then other. And other could include non-climate mitigating investments, or it could include rebates, for example, to households that might be particularly affected by a price signal related to the cap on CO2 emissions. And if you're thinking about these different buckets of investments across the scenarios, you can see there's a couple of key differences in the different scenarios we've looked at so far. One is in the percent of the total investment that's allocated to electric cars or passenger vehicles, and so including light trucks and vans. So scenario A has only a 5% investment. Scenario C is over half of the funds would be invested in electric vehicles, and then B is this hybrid option more in the middle. Another area where there are large differences in the scenarios that we looked at are in the percent investments in public transit. So you can see here that scenario A has the largest percent invested in public transit, and whereas scenario C has none. And again, this hybrid scenario in the middle has 18%, a sort of in-between value. So for each of the 5 scenarios that we've examined so far, we looked at 2 types of health benefits. The first is active mobility benefits from biking and walking that derive from these infrastructure investments. And the second is changes in on-road emissions that lead to air quality changes that have equity and health implications. So importantly, these are just a subset of total benefits that could accrue from addressing transportation. Others include, of course, the direct health benefits from reducing or addressing climate change. And then there are things like potential for improved access to jobs, to schools, to churches and social networks that we did not look at in this study. So to get to some of the numbers, so I'm going to show you several of these types of tables. So just to orient you a bit to the tables themselves, across the top, you'll see these 5 scenarios that we've looked at, including the scenario type and then the percent CO2 reduction cap. So A, B, and C for the 25% cap are presented first, and then the 22 and 20% cap are presented for scenario B. And they go in order in terms of the benefits. So you can see here that the total estimated deaths avoided from both active mobility and air quality range from just over 1,000 in the year 2032 down to 280. And the monetized value of those premature deaths avoided range from 11 billion down to 2.7 billion in the year 2032. And in this last line are the estimated TCI proceeds that are generated from the allowance auctions and then reinvested. As I mentioned at the top, you can see that these values are lower, 8.5 billion down to 1.9 billion. Lower than the estimated value of the benefits. Here again, the difference across the scenarios is quite large. There's nearly a 4-fold difference, underscoring the large impact the policy decisions will have on what the ultimate benefits are from a potential program like this. And then just to point out that this scenario A, which remember had the 5% investment in EVs and the very large percent investment in public transit, turns out to have the largest health benefits in terms of premature deaths avoided and its monetary value. So I'm going to dig a little bit deeper into both the physical activity benefits, kind of break those down, and the air quality benefits. But before I do, I just want to present a few more caveats about the work so far. So as we've said, these are scenarios. They're illustrative. They're not predictive. And there's a lot of assumptions embedded in here that's important to understand. And one is that these scenarios assume that 83 to 93% of the total proceeds generated are reinvested in the transportation system. And the analysis so far focuses on on-road emissions and doesn't directly incorporate potential changes in emissions from the electrical grid that would come from increased demand from electric vehicles. But we have done some initial screening calculations, and we are planning to build on this in phase 2 by doing directly integrating the potential changes in the electricity grid. The air quality analysis is at a scale that's smaller than a county, but it's larger than a neighborhood. So it's very detailed for a regional scale analysis like that. It's spanning 12 states. But it's not intended to analyze changes at the neighborhood scale. And so for that reason, we really avoid going to the level of trying to say something about what might be happening within specific neighborhoods. That would not be an appropriate use of this study. And then there are many climate-related health benefits and other health benefits that we have not analyzed that can come from improving transportation systems. So as I mentioned some of them, but there's also safety, reduced noise pollution, reduced congestion and stress, access to jobs, healthcare, and education. So now to look at a little bit more in more detail at the activity benefits that come from biking and investments in biking and walking infrastructure. So as you can see here, a lot of the benefits, a lot of the total benefits estimated in this study come from increased physical activity that people choose to participate in and when they have access to safe and near, accessible biking and walking infrastructure. So of that 1,100 premature deaths avoided that I showed you in the first slide of total benefits, 770 of those come from estimated premature deaths avoided from increased biking and walking. And this includes biking and walking to and from transit stations. So if there are improvements in public transit, people use public transit more, then there is some additional walking that takes place that has health benefits. So these numbers include those walking benefits that come from public transit investments as well. And here you see the monetized value of these benefits. And then in this bottom row, you see the TCI proceeds that are invested just in biking and walking infrastructure. And so this is of the total amount of proceeds generated, a relatively small amount goes into biking and walking infrastructure under these scenarios, but it generates very large health benefits. And again, here we see almost a fourfold difference as we did in the total benefits for the physical activity benefits. And as with the total benefits, this scenario A, with the large investments in public transit, biking and walking, generates the largest benefits of the 5 we've looked at so far. This map shows you the distribution of the active mobility benefits by county. And this is for that middle scenario. So this is for scenario B with the 25% cap. So we're using one example in this presentation. So we picked sort of the middle example, but the spatial pattern you see here is similar in the other scenarios. But as this shows, there are benefits across the whole region. So all counties in the region see some benefit, and the benefits tend to be concentrated in populated areas, even when looking at it on a per capita basis. So this particular map is net deaths avoided per 100,000 people, or basically a benefits per capita type of map. So even when we take population into account, the benefits tend to be concentrated in more populated areas, not always urban areas, but areas where there are larger populations. And like in Massachusetts, for example, you can see around Springfield, there tends to be high benefits. And in New Jersey, you can obviously, there are relatively high benefits compared to less populated counties in the region. So as I mentioned, just some insights, some takeaways from this physical activity benefits work. We found it interesting that these activity benefits are quite a bit larger than the air quality benefits for the scenarios we're looking at here, underscoring that it can be quite beneficial to have more opportunities. Of course, we always hope that these are opportunities people are choosing to take advantage of rather than kind of being stuck with. And that's an important consideration when thinking about how a program is actually implemented. The top scenario, of course, as we've said, has the largest share of investments dedicated to public transit, biking, and walking. And this is true in the air quality side as well, because shifting from vehicles to other modes of travel has this sort of double benefit. It's sort of a twofer. It both can have benefits from increased activity as well as reduced tailpipe emissions. And one thing that we haven't looked at yet, but we know is very important, and we're hoping to do some local case studies that would allow us to get at this more in a more nuanced way, is consideration of equity when looking at the distribution of these benefits. So we haven't looked, for example, at where the infrastructure is built within a county, sort of what communities benefit and who benefits within a given area, and also how that might affect other assets in a community, for example, like trees and tree-lined streets, and are there trade-offs between bike lanes and trees, and what does that mean for a given community, and who has access to this type of infrastructure? And those are all, I think, very important consideration, certainly when it comes to implementing or allocating investments, whether it's through TCI or through an infrastructure bill, for example. And so we do tend to partner with some groups and take a closer look at that issue. So now I'd like to turn to on-road emissions and the air quality, equity, and health outcomes that we've analyzed to date. But just to orient everyone, we know that air pollution from on-road vehicle emissions has a huge health toll. So we know the stakes are large when it comes to tackling emissions from on-road vehicles, be it for climate change purposes or to address air quality. And so this chart shows you the number of estimated premature deaths from on-road vehicle emissions in the year 2016. And that's the year for which we have the most recent national emissions inventory. And so we took that NEI data for 2016 and estimated the contribution to PM2.5, ozone, and nitrogen dioxide concentrations, and then calculated the health toll by state. And I just pulled out the numbers for New York, New Jersey, and Pennsylvania. And so in 2016, this total number for New Jersey is about 1,650. New York State, it's about 3,000 premature deaths. In Pennsylvania, it's about 1,750. And so your region, of course, stands out as one that is very strongly affected by premature deaths from on-road air pollution. So what our team did was to analyze differences in air pollution from changes in on-road emissions for 5 of these illustrative policy scenarios compared to doing nothing, or compared to a no TCI reference case in the year 2032. So in the year 2032, we're basically comparing TCI and no TCI to look at what the changes in air quality might be. This grid here shows you something more about the scale. So these grids overlaid on the counties, and this happens to be New York State, is just the example, gives you a sense of the scale of the air quality modeling. So we modeled air quality at a 12 by 12 kilometer grid, which you can see here is much smaller than a county scale, but certainly not a community or neighborhood scale. So here we have the air quality results, again, for that middle scenario, scenario B, with a 25% cap. And I'm going to show you a series of maps starting with changes, estimated changes in concentrations of fine particulate matter, or PM2.5. And so that's what you can see here in purple. And PM2.5 tends to have localized effects, and you can see that these are decreases, and the decreases occur along major highways and in urban centers. And so the pattern of the change really tracks the pattern of transportation in the region. And we estimate that under this scenario, across the grids, there would be a 0 to 0.5% decrease in PM2.5 concentrations in the year 2032. In this blue map, you can see changes in ozone. And ozone is a more widely dispersed pollutant, more of a regional pollutant, and so the patterns look a bit different, but in general, you see again the largest reductions along highways and in metro areas. And for ozone, we have a slight increase in one area and then a decrease of 0.3% up to 0.3% across the region. And the area of increase comes due to increased ozone formation with decreased NOx emissions. So this is driven by a decrease in emissions that has this somewhat counterintuitive but well understood impact on ozone concentrations. But overall, we've looked at that grid cell very carefully, and when you take into account the PM and the nitrogen dioxide emissions reductions estimated for that area, the health benefits are still net positive. And then here is a map of estimated changes in nitrogen dioxide from 0.3% up to a pretty large change of pretty large decrease of 5%, which is important for respiratory related health outcomes. So we have these maps and we've posted them now on our website for all of the scenarios. So if you're interested in looking at these patterns and the values for the other 4 scenarios that we've talked about today, you can find that on the TRECH website. So the preliminary results, just to show that we estimate a modest reduction in the inequality of air pollution exposure by race and ethnicity, and I'll show you some of those results next. But there are large disparities that persist. And this isn't too surprising. If you remember at the top, we talked about the emissions reductions anticipated under this program range from 1% to 6%. And so given that, right, you wouldn't expect that that would be enough to close the gap in the pre-existing large disparities in air pollution exposure by race ethnicity. So that tells us that even with progress, there's a lot more work to be done. And we know that the health and equity benefits increase as the cap stringency increases, and that the equity and health benefits are highest in the scenario with the greatest investment in public transit, biking, and walking. So just to take a closer look at those equity benefits, this is a table of estimated population-weighted exposure to PM2.5 in the year 2032. And this is for again, that middle scenario, scenario B, with a 25% CO2 reduction cap. So it doesn't achieve the greatest air quality benefits, but it's actually quite similar to scenario A. And then we stratified the changes in the population-weighted exposure by subgroup. So we looked at the percent decrease in population-weighted exposure to PM2.5 for the total population, for the non-Hispanic white population, for the non-Hispanic Black population, Hispanic population, and other. And as you can see, in this percent decrease is slightly larger. So the percent decrease is slightly larger for the non-Hispanic Black and Hispanic population compared to the total and non-Hispanic white population for this scenario. So the larger number here signifies larger decreases in air pollution exposure and a slight reduction in inequality. However, and importantly, people of color would still face higher overall air pollution exposures. And so that's this column here on the left. And this is not the percent decrease, but the post-policy estimated population weighted exposure by subgroup. And you can see here that there's 2 to 2.5 micrograms per cubic meter difference or increase in the population weighted exposure to PM2.5 for the non-Hispanic Black population and Hispanic population compared to non-Hispanic white and the total population. And that is a substantial difference. So we talked about when looking at the air quality changes that you could see those grid cell by grid cell changes. Those percentages were small. You know, they 0.5 to 5%. But if you take those small air quality changes and look at them across a large, heavily populated region, it can add up to having substantial air quality benefits. And so here, just as we did with the physical activity benefits, we have calculated the net deaths avoided due to estimated air pollution reductions. And we see again this large, more than fourfold, in this case, just slightly more than fourfold increase or difference rather in premature deaths avoided across the scenarios, with scenario A still having the largest benefits. And again, this is here, we've added that up to look at the estimated monetary value of those benefits. And obviously, the scenario A achieves the largest benefits. And if you remember back to the bar graph, at a regional scale, these estimated deaths avoided represent about an 8% decrease in the total deaths from on-road emissions in the TCI region in 2032. So we see an 8% decrease in estimated deaths from air pollution exposure from on-road vehicles under this scenario, and that's from a 6% decrease in carbon dioxide emissions and the companion improvements or reductions in NOx and SO2 and ammonia emissions. So just like we saw on the physical activity side, this is a map showing the premature deaths avoided, in this case, per million across the region by county. And we see that all counties do see some improvement, with the largest health benefits in the most populated areas. And again, this is for the scenario B, that middle scenario with a 25% cap. So this is a recap of the results that I provided at the beginning. I won't read through them all here, but you can see that the basic themes carry through from the physical activity benefits to the air quality benefits. And again, I just want to point out that the study showing this wide range of benefits really signals the fact that we're not pinpointing benefits that are guaranteed here. We're showing that there are a wide range of benefits that could occur, and the ultimate benefits will depend on what states do, which states participate, what the cap is, how the investments are made. And in providing this information, our hope is that it can help steer those conversations and decisions to get the most health gains and the greatest health equity from any program if it were to go forward. The other thing I'd like to say is that I think more than anything, this work shows really what's at stake from a health and equity perspective when it comes to transportation emissions. So whether it's through this program or different policy approaches, we see that these transportation emissions and transportation systems have a huge effect on health. And however these reductions are achieved, it's very important to prioritize addressing the transportation sector, given the large health benefits that we see from even modest, relatively modest changes. So whether it's through this program or some other approach, this information can be used to make the case that the transportation system is having a huge effect on public health, and that actions are needed to drive down emissions and to invest in public transit and other infrastructure. In addition to TCI, I'm sure you all are aware, there are other programs that could be evaluated or could be used to help achieve some of these gains, including things like investments made as a result of a national infrastructure bill, or from state bonds, or it could be from policies like MOUs related to medium heavy duty trucks in the region. So we hope that the information generated here can be useful in making transportation decisions broadly. And what's next? So we will be producing another research update soon that includes all 9 TCI scenarios. So we begin to pull that information together. We'll be submitting that research to peer-reviewed journals. Actually, we've already submitted 2 papers. We have another one in the works. We'll be expanding the equity analysis. I showed you results from just one scenario, so we will expand that to look at the other scenarios. And as well as looking at air quality, we'll also look at the equity of the health outcomes themselves and look at income and education. Then the next stage, we plan to look at scenarios beyond the scenarios generated by the states. So transportation scenarios, broadly speaking. And then also we plan to look at integrate the grid emissions, as I mentioned, so that we're looking at the whole system. And then we plan to undertake one or more local case studies in an urban area with high levels of air pollution. And so right now we're looking at Boston and the New York metropolitan area for those case studies. And that's it for now, and happy to take any questions. And I just want to thank all of the team members listed here for incredible amount of work done in less than a year's time to try and compile the information that I shared with you today.
Thank you so much, Kathy, for your very interesting talk. And I am going to now turn it over to our wonderful colleague, Jean Herb, who's been monitoring the chat box and who will moderate, who'll be able to ask you a few questions. And I'd also like to remind folks that we're happy to get some additional questions from you. Just send it to all panelists in the chat box. Take it away, Jean.
So Kathy, there's a question about, so you mentioned that in the next phase, one of the things that you'll be doing is kind of more of a zeroing in down on 1 or 2 areas. So the question is just whether there's any expectation that you'll be able to get to the sub-county level within the rest of the region at all, or will the rest of the analysis continue to be at the county level?
So just to be clear, the air quality results are at 12 by 12 kilometers. So that is sub-county. So that, I just want to make sure that people are aware that they can access the information at a sub-county scale for the air quality results. And then we summed that up to the county scale when we looked at the health outcomes. But that air quality information is available at 12 by 12 kilometer grids. So that's about, somewhere between 20 and 25 grids per county. And then we don't yet have plans or funding to look at a neighborhood scale, other than in these 2 case studies. We'd love to do that, or we'd love to partner with other people who might do it, maybe using similar methods. But right now, the only plans and funding we have are for those 2.
Okay. Also, you mentioned that some of the future work will be looking at all of the TCI scenarios. Just wondering if you could give us a little bit of a sense as to whether those are radically different than the ones that you were able to look at. You know, should we expect significantly different outcomes?
That's a great question. No, I don't think so. So we'll continue to have these three investment scenarios. What we'll be adding is the 20 and 22% caps for scenario A and for scenario C. One of the things that's come up since we started this work, there was a webinar a while ago where there were some plans described for focusing, making commitments to focus a certain amount of the investments in underserved and overburdened communities. So we might try and look at that, but we don't actually know how, what that means and how to do that yet. And we would also need to understand what's the current level of investment in those areas that's reflected in the scenarios we have right now, and then how much of an adder would that be? So we're thinking about it, but we don't yet have scenarios in hand to analyze that. So the next batch will be quite similar to the ones you see here.
Mm-hmm.
That said, after that, in the next phase, we'll be going beyond the state-defined TCI scenarios and looking at transportation scenarios based on input from stakeholder groups and from my fellow researchers.
Okay. So there's a question about whether you considered transportation, considered investment of proceeds in strategies that involve avoiding transportation, such as working at home scenarios.
Yes, so demand reduction. There's been a lot of interest in broadband, like whether or not investing in broadband would decrease vehicle miles traveled. There is some reduction in vehicle miles traveled through the buckets that you see here, but I wouldn't say that there is a strong emphasis on that. Just by, if you look at where these investments are going in the scenarios that we have in hand right now, there isn't a large emphasis on telecommuting or broadband investments that would shift vehicle miles traveled significantly. That would be one to put on the agenda for a next round.
Mm-hmm. Okay. So there's a question about whether since California's cap and trade program is economy-wide, whether you were able to mine any of the experiences there in terms of health benefits or ozone or PM reductions, or is it still is their program still too early to tell?
That's a great question. I actually have not looked at what the California program has achieved. I know that there's been various studies done. So the answer is no, I haven't looked at that. And one of the things that's challenging when you do that is trying to figure out what would emissions have been without the program and with the program. So in some states you see growth in vehicle miles traveled over time as population grows. And the difference, say, in 2022 to 2032 with the program in place may not be what was hoped for, but it may be better than without the program, if you see what I mean. So there's a change over time, and then there's the difference in any given year between having the program and not having the program. And those are some of the things that I would be looking for if I were to look at the California program and what it's achieved, not just how has air pollution changed over time, but is it any better now than it would have been without the program?
Okay. So there's a question about whether, so based on this and having just looked at this for the first time, are there winners and losers among the states under these different scenarios where, you said that most of the health gains seem to be in places that were especially populated? Does that mean that more rural states are not seen, or sort of maybe pressed to find justifications for participating in TCI if their health gains are not as significant?
So certainly, I'll just pull up one of the maps here. Certainly, we see both in active mobility and in the air quality related health benefits that more rural areas and states do have lower health benefits. But importantly, there tends to be lower health impacts in those areas from the outset. So that's not all that surprising. And it doesn't mean that a program like this wouldn't be valuable to those states. I mean, I think any benefit that is estimated or achieved is a gain for those states that has value.
Yeah.
One of the things that comes up a lot is if these emissions reductions and infrastructure investments are made through a cap and invest program, what does that mean for gas prices, and what does that mean for people in rural areas who often lack other options for transportation besides driving passenger vehicles? And so I think that that's brought a lot of attention to that question, and there's some work that I think will be done looking at cost per household and benefits per household, and whether or not there would be ways to address the potential cost effects in rural areas, which would be important to consider alongside the health benefits.
Oh, that's interesting. So there's a question about that. So you were able to look at benefits to different populations based on race and income. Were you also able to look at it based on age? So, in terms of older residents who, may have compromised health, or younger who are more vulnerable?
Not yet, but we do have some children's health outcomes that we do plan to look at what the equity effects are for children and children's health outcomes. Most of the other health outcomes are for adults aged 18 to 64, and it often takes into account the burden of disease by age group, but we have not looked at the equity effects by age.
Okay. And so just one other question on the list is, were you able, as part of the investment scenarios, to consider on-demand vehicles or the future of, projections in terms of penetration of autonomous vehicles within the region? Or is that just way too speculative at this point?
I believe that in this ride-sharing bucket here, that on-demand vehicles were taken into account, but I don't believe that autonomous vehicles played a big role in the scenarios that we have so far.
Okay.
And we do have a breakdown for each of these buckets, a finer breakdown. So I could pull out sort of the ride-sharing component there and provide some information on what percentage was allocated to ride-sharing.
Okay. And I guess just one last question, Marjorie, which is just whether, as you were looking at some of the future scenarios, whether you were able to take into account future expectations in terms of climate scenarios, right? So, for example, in terms of precipitation or temperature and how it might affect PM or ozone, or is this based on current climate conditions?
This is current climate. So, and that's a great point. Ozone is the pollutant that's probably most sensitive. And under higher temperatures, you do tend to see greater ozone formation. but this assumes stable climate. And so in that case, the benefits, this might be a conservative estimate of the benefits.
Okay, so that's really interesting. So Marjorie, I think that's all the questions that I'm seeing.
Well, thank you so very much. We'll give it, a second more. If anybody has a question, quick type it into the chat. Otherwise, on behalf of all of us here at the Climate Change Resource Center, we'd like to once again thank Kathy for a very informative session. We're really looking forward to seeing the rest of your study. It is very nice of you to give us a sneak peek, if you will. And we know how hard it is to do this research, so we're very grateful that you took the time to do that, to share it with us. And for those of you listening, we hope you'll join us for our next Climate Academy. It will be Monday, November 16th at noon. We'll be joined by Dr. Nicholas Procopio of the New Jersey Department of Environmental Protection and Dr. Judith Weiss of Rutgers University, and they'll discuss the status of New Jersey's tidal marshes, how they're doing with respect to sea level rise, and remedial actions that could be taken. And so this concludes today's event. Thank you so much.
Kathy, thank you so much. It was so amazingly interesting. Thank you.
Oh, thank you. My pleasure. Feel free to shoot any questions my way.
Okay, we will.
Great.
Thank you.